Hello, friends. In today's section, we are going to learn how to approach an accident or an emergency. So, say you find someone who is lying unconscious, or you feel there's something wrong about them. What do you do first? Do you straight run to them? No. Yes, you should run for help, but first check that there are no hazards in the surroundings, like oncoming traffic, a live wire, um, fire, things like that. So just be mindful of where you are going to, so that you do not put yourself in risk. Then you should tap on the shoulders, and ask. Check response. Are you okay? Ask them, are you okay? Tap on the shoulders like this and ask, what happened? Now, if they are alert or responsive, now alert and responsive mean that they understand what you are saying and they are able to answer your question. They are able to talk properly and are able to answer, give an appropriate response. Now, if that is there, then they can tell you what is, if they are okay, and if whatever happened, and what is the problem. In that case, yes, what you do is offer help and any first aid as required. If there's any injury, bleeding, anything that you can just offer help, understand what the situation is, offer help accordingly. But understand that this we are talking about your generalized approach for any sort of emergency. So remember, after checking for hazards and check after checking surroundings, you check response. Basically, just makes common sense. You go before you going checking, and then that things are all right. Then you go check response. If you feel that they are not alert or responsive, that means either they could be drowsy, they could be unconscious, or they could be breathing so hard, or finding it so difficult to breathe that they are not able to speak. So that means it is no, they are not alert and not responsive. In that case, if you feel their response is not good, that means there could be a problem in A, B, C, D, which is airway, breathing, circulation, or disability. And that means that it could be an urgent emergency. So the first thing that you do is call for help. And as you call for help, so you need to remember three things. That how you call for help is basically tell them, remember www. So where you are, who you are, and what do you need. So if you remember these things, you will be able to call for help accordingly. And then what you just need to do is, if once you have checked response, called for help, check if they do not have a response. In that case, you need to check their breathing. The worst case scenario that can be, and it is rare, but if you feel that they are just not responding to anything, their breathing is not there, and you should do this quick. In that case, you will have to do something which is called a CPR, which is uh, cardiopulmonary resuscitation. But in this, we you should just focus on giving the chest compressions at the center of the chest, like this, and which should be push hard, push fast, and that is how. Because you must understand what has happened. If somebody is not, if they are unconscious and they are not breathing, that means they are almost dead or about to be dead. So this exercise is sort of trying to bring someone back from dead. But in most cases scenario, the person would be alert and responsive. You offer them help. If they are responding, but like either they are drowsy or not able to give you proper response, then once you call for help, if they are breathing, yes, then turn them to one side, which is like recovery position. Or just doing that will ensure that they are able, so that they do not choke. If they are unconscious, they do not choke on any saliva, or their own tongue, and their airway does not get obstructed. So in essence, this is all that you need to remember. Of course, if it is an accident victim and you are suspecting a neck injury, you should keep them in that position only, and you should learn about something which is called as a jaw thrust maneuver, which you should tune on to our next video, in which we'll talk about how to manage airway in a person, and what is the necessary first aid that you can do. So this is all, friends. See you in our next video. Thank you.